Well, good afternoon or morning to all of you, depending on where you're calling in from. I do have 2 o'clock, so we'll go ahead and get started. I'd like to welcome everyone to today's webinar on Workforce Development Planning, brought to you by the NACCHO CDC Accreditation Support Initiative. I'm Rena Chudgar. I'm a program analyst on the Accreditation Preparation and Quality Improvement team here at NACCHO, and I'll be serving as the moderator for today's webinar. Please note that today's 1.5-hour webinar is being recorded, and the archive recording will be made available to all sites after today. And the slides were sent out to all sites yesterday via email and also attached to the calendar invitation. Let us know if you didn't receive them, and we're happy to resend them to all of you. Additionally, please make sure to also call in or log into the web portion if you have not yet done so that you may follow along. Before we get started, just a few notes regarding muting and unmuting your line. If you wish to mute or unmute your line to ask or answer a question, please do the following. To unmute your line, press *7. And to mute your line, press *6. Currently, all lines are on mute mode. When you are in unmute mode, please be mindful of any noise in the background in your office, as this can be heard by all webinar participants. And as soon as you're done asking or answering or responding to a question, we do ask that you remute your line by pressing *6. Additionally, immediately following the webinar, you will be directed to an online evaluation, and we'd really appreciate your feedback to help us to continue to improve future trainings offered through the ASI and beyond. The topic and content for today's webinar was selected and based on feedback given by all of you in the TA Needs Survey and other communications with you throughout the project thus far, so we thank you for that. Our learning objectives today are to describe processes for completing the Workforce Development Plan, provide some examples of Workforce Development Plan formats from colleagues in the field, discuss strategies for assessing core competencies across staff and incorporating them into job descriptions, and describe ideas for addressing identified gaps in staff competencies. Our agenda will include a presentation by 3 different local health departments, each of which will describe their workforce development efforts at their agency. We'll have an overall Q&A session at the end of the webinar, and also, time permitting, we'll have time after each presentation for a few questions. We do request your active participation in today's webinar. If you have a story or your own experience to share as we proceed, please do chime in. You may also use the Raise Your Hand feature located in the upper left-hand side of your screen to let us know when you have a question or comment. And also, you can submit your questions or reflections using the chat box on the lower left-hand side of your screen. We'll be monitoring your submitted questions, and they'll be answered as appropriate throughout the webinar or during the Q&A portion at the end of the webinar. We're very excited to have our speakers on today's webinar. Between the 4 of them, there's a wealth of knowledge and variety of perspectives related to accreditation and workforce development. So it's my pleasure to introduce our speakers. We have Diana Diamore, who is the project coordinator at Norwalk Health Department in Connecticut. She manages organization-wide and multi-sector activities related to public health systems and outcomes, which include accreditation, QI, performance management, workforce development, community health improvement planning, and policy development. She previously worked at the Connecticut Association of Directors of Health, where she supported advocacy, health equity, performance assessment, and communication efforts. Next, we have Rosemary Chaudhry. Rosemary is Assessment and Accreditation Coordinator at the Delaware General Health District in Delaware, Ohio. Rosemary has graduate degrees in nursing, public health, and health administration. She's a board-certified clinical nurse specialist in public health, and her research interests are public health nursing, public health infrastructure, environmental public health, and access to care. And her public health practice and advocacy interests are environmental health, health equity, community engagement, and social and environmental justice. Also from the Delaware General Health District in Ohio, we have Amy Whitney, who is the Benefits Specialist in the HR Department. Amy has a bachelor's degree in Women's Studies from Wittenberg University. She was on a training committee that created the Workforce Development Plan for their agency and is involved in the implementation and revisions of the current plan. And last but not least, we have Cindy Hotchkiss, who's the Director of Health Promotion of the Health Promotion Division, as well as the Accreditation Coordinator of the Missoula City County Health Department in Montana. She graduated from Montana State University with her BS in nursing in 2007 and started working for the health department as a public health nurse after graduation. As Director of Health Promotion of the Health Promotion Division, she oversees multiple community health prevention programs, including the DUI Task Force and Let's Move Missoula, as well as the department's work in emergency preparedness, infectious disease, and public health accreditation. So thanks again to all four of our speakers for being here today. And with that, I will turn it over to Deanna to get us started with our first presentation.
Sure. Hello, everyone. My name is Deanna Diamore. As Rena said, I work at the Norwalk Health Department. We serve a population of about 86,000. We just serve the city of Norwalk. So geographically, we're 23 square miles. We're part of the New York metro area. We're about an hour from New York City, and we have a pretty diverse community. 69% of the population is white, 14% are black, 5% Asian, and 9% other. 24% have a Hispanic or Latino origin, and about a third of the population speaks a language other than English at home. Our health department, we have about 23 full-time staff members and 9 part-time, so it's about 27 full-time equivalents. We have a 6-member Board of Health as our governing entity, and we're organized within 6 different divisions. We have environmental health, health education and promotion, disease prevention, laboratory services, emergency preparedness, and administration. So to give you some background information, we completed our workforce assessment in December of 2012. We finalized our workforce development plan in May of 2013. And prior to this, we didn't have any experience with conducting a workforce assessment, developing an agency-wide workforce development plan, or experience with utilizing the core competencies for public health professionals. We have our site visit in 2 weeks, so we're busy preparing for that, and we haven't heard back from the site visitors yet about how we've done and how we've scored with the workforce development measures, so I just wanted to let everyone know that what we have done hasn't been certified yet by FAB. So for our workforce assessment, we were contacted by the Connecticut-Rhode Island Public Health Training Center, and they reached out to us and said that they could help us with conducting a competency-based needs assessment for our workforce development efforts. So we met with their staff and then staff from other local health departments who are also working on this. And we discussed the different approaches that we could take, and it seemed to be 3 main ways that we can go about conducting the assessment. We looked at ways we could survey staff on their needs and interests. We could survey or interview staff to assess their competency levels, or we can conduct a workshop to prioritize competencies. So that would involve assessing and prioritizing in one meeting. So we would introduce the core competencies to staff and then utilize QI tools to prioritize. And we got these ideas from the Public Health Foundation. After having that discussion, we decided that we wanted to conduct a staff workshop, and there's a few reasons for that. We thought it would be an efficient way of completing the assessment. We could complete this within 1 meeting with staff. We thought it would be a great opportunity to utilize quality improvement tools, and it's in line with our efforts to continue to build a quality culture. And it would allow us to take into account multiple different criteria into our prioritization process. And there were 3 criteria that we really wanted to include, and those were to look at the relevancy to the competency to the entire department, determine the current capacity level of that competency, and then look at the value that we placed on that competency. We thought it would also allow staff to decide on the relevancy and importance of the competencies, and we were looking for an approach that aimed for consensus, and we felt that this would be a way to do that. So during the assessment, we reviewed the FAB requirements for workforce development. We then described and discussed the core competencies for public health professionals, and we found a PowerPoint that was on the Public Health Foundation's website. And so we modified that, and we added our own examples to demonstrate how we practice the different competencies. And we kept the discussion of the competencies at the broad domain level, and so at this point we really didn't get into the specific skills that you'll find in that full document. We described how quality improvement tools can help prioritize what core competencies to focus on. And we utilized the two QI tools, the prioritization matrix and a pick chart. And a pick chart stands for possible, implement, challenge, or kill, and it's a Lean Six Sigma tool, and I'll explain it more as we go on. People also refer to it as a 2x2 matrix. And this took us about an hour and a half to complete. I facilitated the assessment, and the participants were our accreditation work group, who are from all the different divisions of the health department. And again, we looked at the Public Health Foundation for guidance on how we should conduct it, and we found different approaches, and we sort of chose the components that we thought would work best for us. I'm sure some of you have seen the prioritization matrix before. It allows you to compare each competency against each other to determine which is more relevant. So we assigned a numerical value to describe the comparison, and the discussion went, are blank skills more or less or equally relevant to the entire department than the other skills? And this is what it looks like. We did it in Excel, so we were able to plug in the values as we went. We changed number 5, which is community dimensions of practice skills, to community engagement just for the discussion, because I thought it was an easier term for the staff to wrap their heads around. We thought that this tool was a little confusing at first because staff had to go back and think about, well, what do these competencies really mean? Because they were learning about the competencies at the same time they were, prioritizing them. So we had to go back and redo some of the comparisons. And I think that if we were to do this again, we would practice this tool with an easier example, and then we would go and use it with the competencies. And we aimed for consensus on this, and if we didn't get it, then we would just have everyone raise their hands, and we went with majority. When we use this tool to narrow down the list to 5 competencies. After conducting that, we did the pick chart. So we asked each staff member to score the competencies that were left on a scale from 1 to 5 for both of the criteria. So the criteria, as I said, were our capacity and then the value and benefit that we placed on it. And so everyone wrote down their scores on a note card, and then we compiled them to create a group score. And we found this tool to be much simpler to use than the prioritization matrix. So here you can see our scores, the group scores for the different competencies, as well as where they were placed within the chart. And it's interesting because you would think you would get more variety in locating different competencies in the different quadrants, but we scored all of the competencies pretty high in terms of the value we placed on them, and then also what we thought our capacity was to practice those skills. So we decided to really just focus on the 2 that were our lowest scoring, and those 2 were cultural competency and communication. So I'm just going to go back. The idea is that you want to develop, if there were competencies that we had a high value and benefit on, and then we felt were a low capacity, those were the ones we would want to focus on. But we scored higher than we thought we would. So after, like I said, it was an hour and a half, and so then we had our 2 competencies that we wanted to include in the plan. to develop the plan, we utilized and modified the Ohio template, the Ohio Workforce Development Plan, and we thought it was a great template, so we selected the parts that we thought were relevant to us. Ours is shorter than their full template, but we were sure to include all the requirements, all the FAB requirements. And within the plan, we included trainings that were related to the core competencies, ones that were related to continuing education that are required by our disciplines, and then other trainings that are relevant to the strategic direction of the health department. So I've included just an image of the table of contents. I've highlighted here just how we mention the core competencies within the plan because I know that's a FAB requirement. And we included a full summary of how we conducted the assessment as an appendice. We didn't include it in the plan itself. And then you can see here's the mention of the continuing education, and that relates to food certification, lead, CHES for health educators. We have a nurse practitioner on staff, so we included her requirements to maintain her APRN. And then for our WIC staff, we have certified lactation consultants, and we have one registered dietitian. And then on the bottom of the page, you'll see the other trainings that were relevant to the strategic direction, and those include quality improvement, performance management, confidentiality, information technology, and emergency preparedness. Here's the page from the plan that has our training goals and objectives, and those relate back to what I was just saying about the core competencies and the continuing education and the strategic direction. So if you look at the first line, the first goal is to enhance cultural competency and communication skills within all health department staff. And then there's the objectives to identify those training opportunities and to hold the trainings. And then so on with the required disciplines, and then there's several goals around quality improvement, performance management, and then we included emergency preparedness because that's something that's mandated and that all staff should complete those trainings. So this is the first time we've done this, and so we thought this would be a good start for our efforts. This is the curricula and training schedule. It has more detail about the specific trainings that we were going to conduct and the target audience. And then I've highlighted how we included the competencies that were addressed within these trainings. Many of the other trainings that are included also address the core competencies, so we made sure to include the link there. What I did was I referred back to the core competency document, and then I just identified the skills that I thought were relevant to the different trainings. And for the cultural competency and communications, it really is just an introduction. We held an intro session with staff back in June, and then we've had trainings about external communications after we developed the policy. And we're going to continue to do this in the future. And I also wanted to say we didn't spend that much time on the different tiers. There's tier 1, 2, and 3 within the competencies. We weren't that concerned at this point about the different staffs and who should know what. We really focused on what should the entire staff know. And we included, skills from all the different tiers. And I know there was a question about how the workforce development plan is linked to other plans. So that's why I included this slide. So I just wanted to point out that Goal 5 of our strategic plan is to establish an agency performance management system, QI system, and workforce development plan. So we have an activity that involves conducting trainings for QI workgroup members, and that's included within our workforce development plan. And then there's an objective around just producing that workforce development plan and conducting those trainings. And then in our QI plan, our first goal is to have staff receive ongoing training in QI. And then our future plans, we're going to update our plan by June of this year. We're going to check in with staff to see if cultural competency and communications are still the top priorities, and we're going to identify more advanced trainings in these areas if that's true. And then we're going to include new trainings important to our strategic direction. We've already talked to staff, and they've identified 2 that they'd like to include next year, and one of them is related to cultural competency. There's a need within, mostly out in the field, to have some basic Spanish translation skills. When we're in-house, we have staff that are fluent, but it's more difficult when they're out, inspecting restaurants. So we're going to figure out a way to do that for next year. And then a staff member also mentioned ergonomics, to be able to set up your workspace properly, so I think we're going to look at that too. We're going to include an additional appendix in the report that has a tracking spreadsheet, and that summarizes how we've implemented the plan within the past year. We're going to make improvements based on what the site visitors have to say about our plan, and then we're going to consider conducting a survey with the entire staff next year to assess their competencies. And that's it.
Great. Thank you so much, Deanna. It's a lot of great work being done at Norwalk. We do have time for 1 or 2 quick questions if anyone has any. I know we've had a few questions via the chat box that I think I'll save until the end, so all speakers can address them. But any quick questions for Deanna, you can either chat them in or press *7 to unmute your line. Okay, well, of course, if questions come to mind, again, feel free to chat them in. But then I will move us on to our next presenters. Rosemary and Amy, feel free to take it away.
Okay, thank you. This is Rosemary, and I'm going to start us off here. Oh, wait, I'm sorry. I apologize. Okay, so about our agency, we are what you might consider a combined city and county health department. Our title is Delaware General Health District. You see that we serve a pretty large jurisdiction, and we are a mix of rural and suburban. We have 4 divisions. I am in the APE division, or Assessment, Planning, and Education, and we do cover community assessment such as MAP, developing the CHIP. We have done the PACE environmental health assessment, and we do other assessments as we need to. Our division is responsible for accreditation, program planning, and health education in areas such as obesity, chronic illness, injury, highway safety, to name a few. Our other divisions include environmental health, which does the standard environmental health services such as food service, campground inspections, sewage plumbing. We also do solid waste and recycling, and vector-borne surveillance testing and control. Our personal health division includes public health nursing and women, infants, and children, which we cover for our county and 2 others. And our administrative division, which includes Amy, my co-presenter, covers the usual human resources, fiscal, IT. We also have vital statistics, a public information officer, a webmaster, and a wonderful health commissioner, too. And we were accredited. We got our notice last week. There we are. I'm not going to spend too much time on that ghastly picture because it's got me in it, but we're holding the FAB accreditation sign, so that was a happy event for us. And I'm going to turn it over to Amy. She's going to do the first half of the presentation.
Hi, this is Amy. We actually had an internal training committee that formed. It actually formed in July of 2011. That says September, but September is when we actually started writing our workforce development plan. And we kind of came at it from a different angle. We were writing it as a usable plan. We didn't necessarily have accreditation on the brain when we started it, but it kind of evolved into that. So we started in September with our training committee, which is a multi-division group with various managers and staff from various levels throughout the division, with all the divisions being represented. We weren't using a template at first, and we found that to be kind of hard. So since we're so close to Columbus, we know a lot of the people at Ohio State. And so we knew some of the people at the College of Public Health, and we reached out to them, and they said, well, hey, we're working on this template, and it worked out kind of perfectly. They had just finished it, and they needed somebody to pilot their program. So we were actually their pilot group, where we used it and we gave them feedback once we were using it to tell them, any feedback that we thought was helpful. And they were super helpful with us, with sharing that with us, because it really gave us a starting point to use for the workforce development plan. We finalized ours in October of 2012, but in the winter of 2012, we had a workshop with Melissa Sievers from Ohio State, and she came and gave us a workshop on our goals and objectives section, because that was an area that we really wanted to use, and we do use that a lot, but we needed help kind of honing in on where we wanted to go with it, because we were a little bit all over the place. And succession planning was very important for us, because we have a lot of employees of our nursing staff and our executive team that are near retirement age. So with her workshop, that really helped us to kind of stay focused and have some place to begin with that. So then with our needs and assessment, again, since we already had a needs and assessment that we had done, so we were able to use the results that we had done already in our workforce development plan. But having said that, I would maybe structure ours differently going forward. And we did do a separate one in 2013 that we did structure differently, because our original needs assessment was kind of just to the staff of like, what kind of training do you want? What kind of roadblocks do you run up against when trying to find training? And we left too many open-ended questions, and it turned into a climate survey. So in regards to that, I would definitely next time kind of focus it more on the competency aspect of it rather than just training needs. Let's see. And we used a lot of the information that we got from the training needs, and from that we found that a majority of our staff in general said that they wanted more leadership training, computer, grant writing, time management, and we were able to direct our agency-wide training through that, and we did have a outside speaker come in and for the whole staff and do a leadership training. We had a speaker from Ohio EPA come in and do a grant writing training, and we had one of our internal people do a computer training for everybody. So we really did get some useful information, and it was able to kind of guide our training for those years. Let me try and move this. Okay, did I do it? Sorry, I don't know how to work the computer. Okay. In writing our workforce development plan, like I said, we had a training committee, and I found one thing that didn't work for us, which you might want to also think about, is I had originally put a Google Doc out for everybody to kind of be able to make their changes on it. But with a committee of 7 or 9 people, it becomes very confusing. So what I did is I then switched it to where I was the gatekeeper and I was the only one that was making the changes. And instead I had the entire committee give me the changes. That way you can kind of track what you're doing rather than it be a free-for-all with everybody, because everybody's going to have their own opinions of what they want added to it. So I would definitely recommend having maybe one person be in charge of the document. But then you get input as needed. We went to our health commissioner a lot. She gave us a lot of really good input. We met with other local health departments that were going through it, especially when it came to core competencies, because that was something new to a lot of us, and we really needed to kind of touch base with people on that to help us understand that. And then you really want to get your program managers involved if you're doing a goals and objectives section. I know not everybody does that, but I've really liked that. And you really need to kind of get the program managers on board because a lot of the action steps that you need to take involve them. So as much buy-in as you can get from them, the better off you will be to make it all flow smoothly. And they also gave me a lot of good feedback too, because anything that didn't make sense, I was able to rewrite, or anything that they just didn't think would work, or they gave other suggestions that maybe priorities they thought that maybe our committee hadn't thought of. And as far as moving forward, we are in the process now of doing a major revision of it. We had said in our plan that we would revise it annually, and we are doing that. Any small changes I'll kind of do periodically, but as far as like a really major revision, we're going to try and only do that once a year, if not maybe spread it out even a little further. Especially, we were kind of waiting to see what our site visitor said and kind of take any items she had given us and try to work from there. And they gave us quite a few things, especially with core competencies that we needed to work on. And we're going to work those into our revisions now, probably in our goals and objectives section as action steps. Maybe I'll let Rosemary take over a little bit here.
Okay, so I am going to tell you a little bit more about the specifics in our site visit report for the relevant measures in Domain 8, and then talk a bit about what we are thinking about doing with job descriptions, though we're not sure yet, and then integrating the workforce development plan into QI, the strategic plan and performance management. So for Domain 8, that's a standard 8.1. I should have put measure 1.1.1. And that measure is to establish relationships and or collaborations that promote the development of future public health workers. This is pretty much an FYI because it's not really part of our workforce development plan. We did get fully demonstrated, but you see that we did have an opportunity for improvement to try and be a little more deliberate and organized in our efforts so that we can really cultivate those relationships and opportunities with our academic partners. So moving to the next measure, which is to maintain, implement, and assess the Health Department's workforce development plan that addresses the training needs of the staff and the development of core competencies. And though we were, again, fully demonstrated on that, we did have opportunities for improvements, which stated basically that although our health department provides the listing of conferences and other workshop opportunities that are offered to staff, it doesn't appear that our agency has a comprehensive, robust approach or strategy to distribute those opportunities in any particular way. And since the workforce development plan needs annual updates, the agency could select a specific area of the plan to enhance, make it more robust, offer more opportunities across all levels of the organization towards the goal of having a stronger approach in the next few years. And we certainly will be doing that. And then again, I apologize, that should be Measure 8.2.2, which is to provide leadership and management development activities. You can see that they only graded us largely demonstrated here. They did say that we provided documentation of leadership training offered, tuition reimbursement, list of training courses and conferences that our staff attend. However, they did not see clear evidence of how the training relates or conforms to the core competencies and which core competencies are being used or selected. They did point out an area of excellence that we are in a unique situation to be able to fund just about any training or staff development that we want to, and we have been able to maintain those training resources, which they found commendable. So you can see that we did not do as well in this measure, and that is largely because of what Amy said, which was we didn't spend as much time focusing on integrating the core competencies as we should have, and perhaps as much as Deanna's health department did. So where do we go from here? One thing we're going to do is look at our job descriptions, and we don't know for sure how we're going to do that, but we have some options in mind. And one that I've been sharing with Amy is work that I did with my colleague. You see her name there, her last name Polivka, it's Barb Polivka, where we were funded by our state public health practice-based research network to map job descriptions for public health nurses across the state to nursing practice standards, the Council on Linkage core competencies, and public health nursing core competencies. And so what we did was we got as many job descriptions for public health nurses as we could from health departments across the state. We looked at each job description and pretty much matched it to how often we saw evidence of the professional public health nursing standards. There are 16 of them. The individual competencies under each of the 8 Council on Linkage core competencies, and the individual public health nursing competencies under the public health nursing competencies, which actually are developed from the 8 Council on Linkage competencies. The other thing that we're thinking about using as we look into job descriptions is the new template that was released by Columbus Public Health, and there is a reference for this in your reference list. This is the cover of it, and you see down at the bottom it's dated, I think it says June
2013.
2013, yes. And this document, Amy and I were on the task force for that, and this task force developed a template to guide health departments to be a little more standardized in their job description, because sometimes the concern is, does the job description reflect core competencies, yes or no, or is it a job description that you really want to even look at? How well is it designed so that you would even suspect that it might address the core competencies? And so the work of the task force was to try and be helpful in helping health departments look at what kind of job descriptions they had and how they might restructure these if they wish. And this was all to help health departments meet the FAB measure 11.1.5, which is implement and adhere to the health department's human resources policies and procedures. So we know that job descriptions are used for evaluation, training, performance management, and so they are very important as we go forward and try to link in those core competencies. And just a bit about the template. It has 8 general sections, and in the area of the competencies, there are 3 levels of competencies that the job description template focuses on. The first is organizational level competencies. In other words, what are the competencies that you want everybody in the agency, regardless of their position, to demonstrate that they are competent in, such as quality, health equity, or communication or teamwork. The next level is job-specific competencies, and when you think of public health staff, for example, you might then use the Council on Linkage core competencies in a job description for someone who is public health staff. And then the third level of the 3-level framework of competency. So I told you about organizational and job-specific. The third one is profession or discipline specific, and that might be public health nursing, health education, registered sanitarian, dietitian, etc. So moving forward, just a bit on how we are integrating or trying to further integrate the Workforce Development Plan into these 3 documents. Again, similar to what Deanna said, our QI plan does call for a competent workforce. Our staff have been trained in elements of quality improvement, the PDCA cycle, how to do a root cause analysis, things of that nature. And if we have a QI project that identifies a need for training, then that would be reflected back in the Workforce Development Plan, whether it was for specific professions or agency-wide. Our agency strategic plan also refers specifically to maintaining the competence of the workforce, and so we have some connection there with the Workforce Development Plan, obviously. Performance management, I'll be honest and tell you that we're just basically rolling that out now, but Obviously, you know how important it is. It's the main focus of the first half of Domain 9. And if we're going to improve our job descriptions and train our workforce, we would expect then that we can enhance our performance management as an agency and go forward with that as a goal too. So here's just a brief summary of what we see as our successes and opportunities for improvement just to date. On the success side, we have had good support from our Board of Health, our senior administration. They are quick to help us build work groups that are diverse in terms of location in the agency. So we have high-level managers and we have frontline staff. There was a good amount of time devoted to developing the Workforce Development Plan. We are lucky that we have OSU right in our backyard. And we have had the benefit of going through accreditation, and the site visit was very helpful. I mean, no big surprises there, but it did underscore areas where we need to develop and capitalize on those opportunities for improvement. On the flip side, where maybe we fell off a bit, I would start with the middle bullet, I guess, that Amy would tell you that the committee was a bit too big to be functional in doing the actual work of developing the plan. And so when that didn't work out, the committee shifted gears and went to a gatekeeper mode where she, as the gatekeeper, would send out drafts, gather information back from everybody, compile them, and make edits in the plan as it moved forward. She has told you that the agency as a whole is not very familiar with the competencies, and I will tell you a secret that we were not even sure which competencies to go with. That's how difficult it was for people to get their hand around the competencies. I came from an academic side before I came to the health department, so it was a little bit easier for me, but I know it's challenging. And we see an opportunity that we're going to try and do maybe something like, again, Deanna did, where we're going to look for competencies that are the ones we should focus on, low-hanging fruit, where we can get people invested and understand why the competencies are worthwhile and get people involved across the agency. And this is our staff. There's Amy down in the red on the lower left. I'm not in this picture, which you're probably thankful for, but a lot of other good-looking people are. And that's all that we have to present.
Great. Thank you so much, Rosemary and Amy. Also doing great work at your agency. Before we turn it over to Cindy, do we have any quick questions for Rosemary or Amy? And again, to unmute your line, you can press *7, or you can chat in a question. Okay, well, I know, again, we do have some questions in the queue in the chat box, which I'm saving till the end because I think they'll be great for all three speakers to kind of speak to. So without further ado, I will turn it over to Cindy.
Thank you. This is Cindy Hotchkiss. I'm calling in from Missoula, Montana with the Missoula City County Health Department. The things that I'm going to talk about a little bit is workforce development overview and structure, how we did our core competency assessment and training, what our workforce development training plan actually looks like, and then feedback from our FAB site visit team. So we're located in western Montana. Our county health department covers 2,598 square miles. Our population served is 110,000, so we serve areas that are very frontier in nature up to the Missoula city urban in nature. It's more like 65,000 people that live in the city of Missoula. We have a total of 89 employees. FTEs we have 76 FTEs. We received accreditation also on March 19th, so last week. I'm very excited about it. We also use the Ohio template for developing our workforce development plan. If I could give anybody any advice, start early because it took way longer than we anticipated. We thought this was going to be something that we could get done in a month, and it actually took several months for us to get through the process. So I would definitely highly suggest that you start early on this. We mostly followed the Ohio template with a few changes. This is just a little snapshot of our table of contents. We just wanted to really make it ours, and so there were some things that we felt were not completely applicable to our needs, and we added in a couple of things as well. So we wrote our core competencies directly into the Workforce Development Plan, and then in March of 2013, we decided that we were going to do a baseline assessment of all staff. So we used the Public Health Foundation competency assessments. We used all 3 tiers and divided it up according to a person's job, and we had every one of our staff participate in this. The results of the assessments were sent in anonymously, and then they were also sent to their direct supervisor with their name on them. But we didn't want them to feel pressured or feel like they were being tested. We just really wanted to get a baseline of where our staff really felt comfortable and where they felt like they needed more work. So that really gave us we tallied it all and then averaged it according to each competency, and that gave us an idea of where our department as a whole was the weakest. The 2 competencies where we scored the lowest were policy development and program planning and public health sciences. So based on that, we sent out an email to all of the staff with some instructions guiding them to the PowerPoint with the council and linkages between academia and public health practice for training, and this is the link for it. And just asked them to take the time to review that. And then we did what we called the sticky note project. So after we identified our weaknesses, and then they were given this PowerPoint so that they could learn more about the core competencies, then we asked them to identify something that either they do in their own work or work that they know one of their coworkers does that would fit into the categories of policy development, program planning, and public health sciences. And we had them write that on a sticky note, and then in our basement of our health department, which is where our health promotion division lives right now, we have a very long hallway with very blank walls, and so we just put a couple of very big pieces of paper in the hallway on the wall and asked the staff to bring their sticky note down and then put it on the sheet of paper. And this is what that looked like. And the results were all compiled into one document. And so we took all of the sticky notes, took all of the comments and what they know that either they were doing or other members of our staff were doing that fit into each of these 2 competencies, and put it together, and then we sent it out to all the staff so that they knew that we really were following up on this, and so they could see what each other thought about it. And we had really great feedback from the staff about this project. I mean, we've had some trainings that fit into our workforce development plan that we make the staff go through and they feel like it's a waste of time, like, HIPAA or, some of those things that you just have to do. But they actually enjoyed this project. They thought that they learned a lot about the core competencies by going through this. So each staff member's individual core competency assessment was used with their own direct supervisor to develop an individualized training plan. We gave them options for different training opportunities that were online or in person or conferences that we knew that were coming up, and asked them to identify what their own personal weakest core competency was, and to identify some training opportunities and put it on a timeline and say how long they wanted to give themselves to get that done. So our plan also includes a list of training that's required for each position, and then it includes a detailed list of training goals with identified resources, due date, and the person responsible, and this is just a snapshot. And we are renewing our plan every 2 years, so our training goals and objectives are supposed to be set for 2 years, but we review it at the beginning of each year to see if there's anything that needs to be changed or something that already got completed that we can mark off. In addition, our plan includes the training schedule for the year, and that's what we update annually. And then if there's anything major on our annual update, then we'll have that reflected in the overall workforce development plan. So we had our site visit at the end of January. We received our site visit report on March 3rd, and we received accreditation on March 19th. During the site visit, we had a lot of questions brought up regarding succession planning for leadership positions. One of the ways that that came up was because whenever we did our introductions to the site visit team, they asked us to say how long we had been at the health department, and about half of our management and leadership team have been here for over 10 years, and some of them have been here for 30 and 40 years. And so it was very apparent that, you know, we are going to have leadership aging out and retiring, and we needed to have some planning for that. So our opportunities for improvement from our site visit report, one of our 3 opportunities for improvement was workforce development. Specifically, they want us to enhance our workforce development plan to include more formal leadership training for all staff. The gist of what we got from that was that they would like us to be able to provide leadership training opportunities for all staff and let them self-identify. Overall, what they wrote into our site visit report was that we have a very nice workforce development plan, that it includes linkages to public health competencies, that we execute many aspects of the plan, and that we just need more formalized leadership development. The suggestion to improve the leadership skills of the leadership team through leadership training, basically we have lots of trainings that we go to as leaders and managers. Some of it isn't specifically about being a leader or being a manager, and they would like to see us offer more of that to our management team. And then they want us to address how we could assess training needs of the current and potential leaders by identifying opportunities such as leadership institutes for developing skills and other courses that would help develop leadership skills. And we do offer a lot of opportunities for our staff to go to leadership training. We've just not been very good at documenting that or following up to see who went, or, you know, collecting any kind of certificates or anything like that. So our proposed revisions are going to include the specific language to include leadership training for managers and supervisors, and also specific language to include leadership training for staff who either self-identify as wanting more leadership training, or for staff whose supervisors would like for them to have more leadership training. This was completely new for us, having a workforce development plan. We've never had one. And so when we started going through the process for accreditation and it was identified as one of the plans that we absolutely had to get done, it was kind of like jumping into a pool head first. I mean, we weren't really sure what we needed to do, and the Ohio template definitely made things way easier, but it did take quite a long time, and now we're seeing the usefulness of it, and our staff and management team are requesting that we include very specific training, and we've started developing surveys to find out what kind of training staff would like to have, and looking at what kind of training the management team would like their staff to have. So we are still really building this. This was our first go at it, and we're expecting to have a very robust workforce development plan. And we did get fully demonstrated on all areas of Domain 8, but it was definitely one of the big things that was identified as our opportunities for improvement. And that's all I got.
Great. Thank you so much, Cindy, and to all of our presenters today. Before I open it up for the Q&A portion of today's program, I did want to just briefly mention that we have a few slides that all of you should have in your slide deck as well on resources and tools that might be helpful. I know all of our presenters did mention the Ohio template, so we do have a link to that on one of the slides. And NACCHO does not promote or support any one particular template, but we have heard from agencies in the field, including our presenters today, that they've had success using the Ohio template. So there is a link to that. And we will also be sending out a follow-up email after the webinar with the archive link and slides, as well as some additional follow-up resources. So you can look out for that in the future. So now it is our question and answer portion of today's program. You can ask a question by typing it into the chat box on the lower left-hand side of your screen, or by raising your hand, or just unmuting your line. And to do that, again, it's *7. And as a moderator, I will either read your questions in the chat box or prompt you to speak and let our presenters respond to your questions. So let's go ahead and see if there are any questions on the line before I get to our first question in the chat box. And again, it's *7 to unmute your line. Okay, well, while folks are thinking of their questions, I'll go to one of the questions we received via chat. And this is for all of our presenters. We have so this is the question. We have a civil commission that reviews and standardizes all job descriptions. Therefore, we have very little capability in changing job descriptions. Do your agencies have flexibility in changing job descriptions? And what suggestions do you have for perhaps the health department that's less flexible and can't easily adjust the job descriptions? So any of our presenters, do you have suggestions, or can you speak to that?
This is Cindy in Missoula. We have a bit of flexibility. A lot of our staff are governed by, are part of a union. And so although we can make some suggested changes to the job description, they all have to be approved by the union before they are considered official. But otherwise, we do have a lot of flexibility, and even our union representatives have not really ever given us any pushback on that one.
This is Amy in Delaware. We really have a lot of flexibility to change our job descriptions if we want. We're not really restricted by any governing anything that keeps us from doing that. So I don't know that
we would run it past our legal team.
We would run it past legal, but other than that, we don't have to really okay it by a board. And we don't have unions with our health department either.
Some in Ohio do.
Yeah.
There are some in Ohio that do have unions, and so they have the same, things to address as, was that Deanna? I forget who said that, who was speaking before, but we as an agency do not.
This is Deanna, and it was Cindy who was talking about the labor unions, but this is true for us too at Norwalk. We have a Board of Health, but we also have a personnel department, and we have pretty strong labor unions here, so we haven't even thought yet about changing job descriptions, because I know it would take a lot of effort. It's something that we would look into in the future, but right now we're not even thinking about it.
And this is Rosemary again. You remember I referred to that research study that I worked on, and we've looked at, again, public health nursing job descriptions, both for staff public health nurses as well as directors and managers. And we did look at what kind of job description template the health departments in Ohio who submitted, what kind they used, whether they used a state Department of Administrative Services template, or a Clemens-Nelson template, which I think is a big HR entity, or whether they had a homegrown version. And we didn't see a lot of variability by the type of template that was used in how well or how poorly the job description reflected either the professional nursing standards or the professional nursing core competencies or the Council on Linkage core competencies. Frankly, nobody did too well on any of those. It was very dismal, the results. We were quite shocked, but anyway. So the template really wasn't a major factor.
Great, thanks to all three of you. Hopefully that helps a little bit with the question. The next question we received via chat is related to, or the question is, trainings are great, but there's many budget cuts and other considerations to take into account. How have you all thought creatively or outside of the box about ways to provide some of these training opportunities to staff, given that there are limited resources?
This is Amy again in Ohio. We try to use our in-house people as much as possible, like if we feel like any of our own staff are experts, like as far as computer training. We've even had our health commissioner give talks on leadership training because she has some experience in that. So use your own staff as much as possible because a lot of them are bigger experts than you think. And community members, we have a lot of and a lot of them are willing to give free trainings to us. We have a lot of community partnerships.
This is Cindy in Missoula. We also utilized some of our own staff to give some very specific trainings, but we put together a sort of one-page guide to some various online resources as well, because a lot of our staff are really busy in their own jobs and they're not sure that they can carve out a very specific amount of time to go to a training. But there are a lot of really great trainings that are available for free online. So we do have like a one-page sheet of that I'd be happy to share.
And this is Deanna from Norwalk. I just want to echo the comments before me. We've looked at our own staff, and then we've used a lot of online training, and we've identified them through Train. We have a CT version, and we're linked to the national website. And then for some of the quality improvement, we've looked at the National Network of Public Health Institutes, and then NACCHO for links for training.
Great, thanks. And as a follow-up to that question, do y'all know of any specific resources there are that connect competencies to training? And if not, we can also send out information in a follow-up email if nothing comes to mind immediately.
The only one that I can think of is the PowerPoint that we used for our staff that kind of talks about what each of the core competencies are and how they're actually put to use in your actual day-to-day world, but nothing that specifically links that part to the trainings. Great.
And there was kind of one more third part to that question as well. So I'm thinking about trainings that are offered to staff. How are you thinking that you'll evaluate effectiveness of these trainings?
This is Cindy again in Missoula. We're having our staff do the core competency assessment every year. And so between that and the surveys that we're sending out to find out what kind of training people are interested in taking, that's kind of how we plan to measure if it's actually effective.
And this is Deanna from Norwalk, and we also have evaluations for all of the in-person trainings that we've developed, in-house, and those link back to the competencies. Like they reflect on their ability to practice those skills.
Great, thanks. I'll pause for a second from reading the chat questions to see if we have any questions on the line. And again, it's *7 to unmute your line. Okay, well, I'll move on to our next chat question. I think Rosemary and Amy touched on this in your presentation, and I'm sure other Cindy and Deanna, you guys are also aware, but can you describe a little bit more about the job description user guide and resource manual? Who developed it again, and what information does it have in it?
Hi, this is Rosemary. So I have it in front of me, and I can tell you that it's relatively short. It's only 6 pages. It begins with going over the history of the development of the template, and the group members for the task force were from the Columbus Public Health Department, the Cuyahoga County Board of Health, and that's where Cleveland is located, if you know anything about Ohio. Amy, Angie, I, and a student intern who was working with me from our health department. We had someone from the Franklin County Health Department, which is the county in which Columbus is located, 2 people from Human Resources at the Ohio Department of Health, and Melissa Seaver, and you've heard her name before because she's done work on the workforce development template. So she was part of the task force and she facilitated. The work started in January of 2013, and then the report came out, as you know, in the summer. And so the next thing is a discussion of the different sections of the template, how you can go in and edit it because it's available as a Microsoft Word document, how it tries to support accreditation. And then pages 3, first of all, is the one where they lay out the competency framework, because I think Amy and maybe Angie would probably agree that there was a lot of conversation about how do we start building job descriptions that include the competencies, and how do you differentiate between different levels of the organization, and which competencies do you use, and how do you make sure you honor both professional competencies like public health nursing and the public health core competencies. Do you need both? And the group thought, yes, you certainly do. So then the next section talks about how Columbus Public Health Department worked to establish competency-based job descriptions for their health department staff. It goes through 10 steps and it gives you some more information. And again, Elizabeth Rancifer, her contact information, her phone and email is right there in the report. Then it gives you an example of a completed job description. And then there are some resources on the very last page, and that's basically what's in the job description user guide and resource manual. And you have the link on the last page of the resources list from the presentation. Beth Rancifer's email is on there. I can read it out to you right now if you want to write it down, though it is in that document, but just for your convenience, it is 614-645-0308. Again, 614-645-0308. And that is Beth, or Elizabeth formerly, but she goes by Beth Rancifer at Columbus Public Health Department.
Great, thank you so much. Yeah, and we'll be sure to include that information in the follow-up email as well. And as Rosemary mentioned, it's also in the slides. Okay, other questions? Again, it's *7 to unmute your line. Okay, well, the next question received via the chat box is how do you account for, or what are some strategies to tailor competencies for staff who don't actually have public health duties at the agency?
This is Cindy in Missoula. The way that we addressed that was that staff who are more like support staff, administrative, secretarial support staff, we still would like for them to know the basics of the public health competencies, so we just had them do the Tier 1 of the competency assessment, and then their individualized training plan is much more broad for public health. So we included them because we want them to still have a base knowledge of public health because they work in a health department, but we don't expect them to know all the in-depth details of everything. So that's how we did it here.
Any other thoughts or suggestions on that?
This is Deanna from Norwalk, and our approach to it was we figured, all staff should be getting training in these different areas, and if you go through the competencies, we felt that, they were relevant to pretty much all the staff, so it was just a different approach. We didn't try to get into specific, positions and all that. It was more, we're all part of the health department, so these are the skills that we want to build together.
Great, thank you. The next question, and I know all of you kind of addressed this in your presentations, but if you don't mind kind of reiterating what you guys said and maybe adding a little bit more about what your process is. So can you please speak to how you plan to update your workforce development plans. How often, and do you plan to kind of do the whole process over, or what's your strategies for updating the current plan?
This is Amy from Ohio. I would say that as far as like annually, we were going to try and do at least like all the basic like demographics and things like that that change. I mean, we're still kind of debating, do we want to move that to 2 years or keep that annually? But as far as like the goals and objectives, we finished a lot of ours and we're ready to kind of come up with all new ones. So I think we are going to try and do that annually. And that's probably going to be where Angie and I kind of sit and do most of the revisions, and then maybe take our goals and objectives ideas to program managers and see what they think and any kind of priorities they need met also. But I think we're going to focus mostly on core competency stuff moving forward and assessments of trainings, etc., and just work it into our goals and objectives.
This is Cindy in Missoula. We plan to redo all of our goals and objectives every 2 years, and also take a look at, like what our public health workforce looks like, because it can change a lot in 2 years. So updating our plan completely every 2 years is what we plan to do. And then yearly we are doing the annual training plan so that we can meet those goals and objectives.
This is Deanna from Norwalk. Our plan is to revise it every year, but to conduct the competency assessment every 2 years.
Great, thanks to all of you. Other questions for our presenters today? Okay, well, hearing none, we'll go ahead and conclude today's wonderful webinar. A special thank you again to Deanna, Rosemary, Amy, and Cindy for their presentations today, and to all of you for your questions and participation. We hope that today's webinar will help you to move forward in your process and inspire fruitful discussion at your agencies. So immediately following the webinar, an online evaluation survey will pop up on your screen, and we ask that all webinar participants, not just the site coordinators, complete the survey immediately. We really do value your feedback and recommendations to inform and make improvements to future training. And again, we will be following up with resources that were mentioned on today's webinar, as well as example workforce development plans from our presenters' agencies, and then other helpful information as well. So be on the lookout for that in the next week or so. Thank you again for participating, and to our presenters today. Have a great rest of your day.